Agenda 2030. As a successor framework for the Millennium Development Goals, the global community rolled out a bigger, deeper, and more encompassing framework called the Sustainable Development Goals, designed to transform our world, lift the poor out of poverty, as well as ensure inclusive and healthy society. On Agenda 2030, we take you on a media trip to the global destination of the future we want. With everyone on board, we focus on the people and their struggle, the civil society and their agitations, the government and her development effort, the global development agenda, its 17 goals and 169 targets. We bring you all the deliberations, insightful conversations and high-level partnerships on the road to global destination. Agenda 2030, showing on this channel. Agenda 2030, leaving no one behind.
On September 25, 2015, President Muhammadu Buhari joined other world leaders to endorse the Sustainable Development Goals at the 70th session of the United Nations General Assembly. Encapsulated in the 17 goals of the SDGs are plans by the global community to end poverty, ensure economic resilience, and protect the environment, while ensuring prosperity for everyone by the year 2030. President Buhari had pledged commitment of his administration to the global agenda at the UN Forum in 2015. To actualize the promise, the President immediately set up office of the Senior Special Assistant to the President on SDGs in 2016. The President followed this up with the appointment of former Deputy Governor of Lagos State, Princess Adejoke Orelope-Adefulire, as his Senior Special Assistant on SDGs. The office was saddled with the responsibility of coordinating Nigeria's bid to achieve the SDGs, working with government at the sub-national level and other stakeholders. Aside coordinating the implementation of the global goals, the Office of the Senior Special Assistant to the President on Sustainable Development Goals has also remained steadfast towards providing interventions to support the subnational governments towards ensuring the acceleration of the achievements of the SDGs in Nigeria. Speaking recently to Agenda 2030 on the interventions, Princess Adejoke Orelope-Adefulire said top on the priorities of the OSSAP-SDGs include quality education, healthcare delivery, bridging the inequality gap, and reducing poverty by using agriculture to attain food security.
What we are doing, as you all know, is to provide some intervention to support the subnational government, the state and the local government in ensuring that we accelerate the achievement of SDG in Nigeria, Sustainable Development, the global goals, which we're signing. We all agree and committed to be achieved by 2030. Some critical goals are part of our priorities, especially the social development, education sector, the health sector, reduction of poverty, and to ensure that we bridge the gap of gender equality as we have presented in our Economic Recovery and Growth Plan, which was presented in our voluntary national report to the United Nations this year. Critical of this thing is to see how we can use agriculture to reduce poverty, and the government is working with Ministry of Agric, both at the federal and at the state levels, to see how we can promote agriculture, invest more in agriculture, get more people to the farm, support the farmers, anchor borrower, and different other programs that they can do to ensure that we have food sufficiency and food security. But unfortunately, we are facing with the issue of herdsmen and farmers, and the federal government of Nigeria under the leadership of the president is working so hard on that, With the new service chief that have been appointed, the Nigerian Governors Forum are working together to see how the sub-national government, under the aegis of Nigerian Governors Forum, work with the federal government to see how we can reduce this insecurity in the country. It's very, very disturbing and alarming. But if all hands are on deck, as they have started in a few weeks, well, it will be a thing of the past. I pray that all of this will be addressed and in a very short time.
On the education sector, the Senior Special Assistant to the President reiterated the need to create an enabling learning environment that will attract out-of-school children back to classrooms. She further explained that some of the interventions provided to support education across the country include the construction of new classrooms and other learning facilities while rehabilitating existing ones, as well as provision of potable water with solar power to provide conducive atmosphere for learning for students and teachers.
So we talked about education. We have too many people outside the school environment, out of school children. And of course, the need to create an enabling environment for those people that are in school and make provision for those that we want to bring back to school. You recall that the president inaugurated the steering committee on alternate school. The essence of all of these things is to make sure that we get all the children of school age back in school. The intervention is to support the Federal Ministry of Education, support the sub-national government Ministry of Education, and ensure that more of our young people that are out of school are back in school. So that is ongoing, and we are monitoring the progress, and we're happy to report that by next year we should make some significant progress. So our intervention in that direction is to ensure that, to some extent, maintain the existing classroom, build more classrooms, and provide water, solar, and make the school conducive for learning for our children. It's our little contribution to support the sub-national government, aside from the conditional grant scheme, which the fund of the federal government that will give to the state government, the 50% to be matched by the state government to provide those infrastructure and to complement what we are able to do as interventions. Majority of the school classrooms that we are building is across the country, and especially when we have a call that we need to urgently provide, we will intervene.
According to Princess Adejoke, good health and well-being remains a critical foundation and mother of all the global goals, as no meaningful development and utilization of social infrastructure can take place without wellness. It is against this precept that the Office of the Senior Special Assistant to the President on SDGs has focused on massive intervention in the health sector. Some of the projects embarked upon by the office include the construction of 80-bed, 100-bed, and 120-bed mother and child care hospitals aimed at reducing maternal and infant death, construction, renovation, and rehabilitation of major hospitals across the country. Shockingly, most of these healthcare facilities have never undergone any major maintenance for up to 30 years.
On health sector, we are supporting the sub-national government through our intervention to build Mother and Child Center, 100 bed, 120 bed, and 140 bed Mother and Child Center. The essence of this is to reduce the maternal death and infant death in Nigeria. We know that federal government alone cannot achieve SDG, state government alone cannot achieve SDG, so we have to work together. So that's our little contribution to support the sub-national government to ensure that maternal death is reduced to the BRS minimum, if not eradicated. Infant mortality to be reduced. Giving birth is not a life sentence, and when you are going to have your baby, the pride of bringing your baby home alive and you yourself alive is the joy of motherhood. And we have been making some progress in that direction. As we speak now, we have completed almost 8 or 10 mother and child center ready in different states of the federation, and some about another 10 under construction that will be ready before the middle of this year. Our intention is to get at least all the state federation to get a bit of our intervention, and that can be achieved this year, God willing, as we move forward. The Mother and Child Center is a very unique project. It provides for the well-being of the mother, right from the gynecology level to the antenatal level, postnatal, and immunization, and ensuring that mother goes there. The issue of eclampsia that kills the mother, I'm not a doctor, but in the course of this, I got to know one or two things. Eclampsia is one of those, the killer of mothers. The provision has been made in our Mother and Child Center to have ICU, 4-bed or 6-bed ICU. And for the children then, neonatal jaundice and other diseases are also part of what kills the baby immediately after birth or a few days after birth. We also have, or especially when you have a premature birth, but we have also in all the Mother and Child Center incubator, phototherapy machine that can address that quickly so that we can have a healthy babies. So all of that we are providing: recovery room, theater, 2 theaters, boardroom, private wards, general ward, where children can play. Also there, when you have a baby, your older baby that you want to have, so they can come in there and have fun. So it's a very well designed and well conceptualized that give mother succor. The joy of motherhood is to go to hospital when you are pregnant for 9 months, and the day of delivery have your baby alive and you yourself be alive.
Similarly, the Intensive Care Ambulance Services Project is a mobile healthcare services initiated by the Office of the Senior Special Assistant to the President on Sustainable Development Goals, which provides immediate medical assistance to the patients in critical and emergency situations, especially in the rural communities where healthcare facilities are not easily accessible.
Our intensive care ambulances that we just launched. Yes, of ambulances, we have normal regular ambulances, and we have these intensive care ambulances that we just introduced. The essence of having that is that not everybody can move from one area to another. Maybe you are not mobile and you are sick and there's no support, but intensive care ambulance can move to wherever you are, can come to you. It's a mobile hospital that can come to where you are, and that mobile ambulance have everything that takes. It's like a theater, moving theater. It can take delivery. There can be minor surgery can be done. To some extent, major surgery can be done. And everything that it takes, like a theater, is available in that man. So we just want to ensure that if you are in rural community or riverine community or wherever you are, we can take healthcare delivery to where you are. You don't necessarily have to travel. And I'm sure that as we go on, all the states of the federation will have a fair share of this, so that they can go to rural community, they can move to riverine community to provide healthcare services to the people of Nigeria. So the logo of SDG is leaving no one behind. We shouldn't expect everybody to move to where the facility of the general hospital, teaching hospital, or primary health care. So if you cannot move there, we come to you wherever you are. And the intensive ambulance is very unique and very, very interesting. We believe that these little efforts can save lives.
while highlighting some of the successes of the government towards the implementation of the Sustainable Development Goals in Nigeria so far. The Senior Special Assistant to the President on SDGs also reiterated the need for continuous collaborations, as she noted that partnership is very key for the successful implementation of the SDGs in Nigeria. She noted that her office has been leveraging on strategic partnership opportunities. She also called for more private sector partnerships, ministries, departments and agencies, donor partnerships, and collaboration with other UN bodies, as governments cannot do it alone.
The whole essence of what we say for everybody to be healthy and be alive. And if you are alive, it's only when we are alive and healthy that we can do meaningful business or meaningful activities that will add value to our life. Without life, nothing. So especially when we have this COVID, at this COVID time, I think that we need to step up our healthcare delivery system, our services, to take more people on board. And we're working with all stakeholders, the subnational government, the ministry, department, and agency of government, to ensure that we accelerate development, we work together, especially the private sector, to work with us also to ensure that we give the Nigerian people the best that they deserve. Our objective is to work with the private sector. The private sector is the heart of SDGs. So private sector working with the public sector. An example of that is the Safeguard initiative that is signed by the federal government of Nigeria, our office, and Coca-Cola Nigeria. And it has helped to keep some of our hospitals, national hospital, and 12 other hospitals in Nigeria to replace their medical equipment. And we are working also to see how we can leverage on that and get more support from other private sector. The private sector advisory group are working on a very robust partnership with the federal government of Nigeria. They are raising a capital of about 100 billion naira in education sector. The partnership agreement and arrangement is still ongoing, and I'm sure very soon we will complete that, and that will be rolled out and be launched. It's going to be a very huge partnership and the first of its kind in Nigeria. So I think that we need more support from the private sector to work with us to support the public sector, as we have the contribution from the donor partners and the UN system. So at this time we need more support for us to be able to get our children back in school. It's very critical and very germane to this government and to this administration. So also the health sector must be revitalized. Also to get the general hospital also to be more functional, and the teaching hospital also to be more functional and maintained. So those are the things. We just finished the Yola Specialist Hospital. Was built in 1938, and I have not seen any major maintenance until when we got there. We have completed almost all the wards. We're working on the emergency department now, OPD, and amenity ward. So with that and doing the landscaping, we will have finished with that very big hospital. It's a teaching hospital. We're also working in Murtala Mohammed Hospital. Kano is the biggest hospital in West Africa. We've started work last year, and it's almost completed. Then of course Wase Hospital, the Urology Hospital, and the VVF Hospital also are part of what we are working on now, aside from the fact that we built a 120-bed hospital in Kano. So all of these things put together is what. So right now we are working in UCH Ibadan, and this UCH Ibadan was built 57 years ago, and there was no maintenance carried out since the hospital was built. Ditto to Murtala Mohammed Hospital and Yola Specialist Hospital. So we expect that we'll go to Ahmadu Bello University Teaching Hospital also during the course of this year to see how we can do some renovation work also there. So in doing that, we want to support the subnational government to ensure that people can walk into the hospital, get the best of that you can get, and reduce medical tourism across the world, and that you can get value for money even within Nigeria. So we'll continue to do make a little contribution to add value to life and improve on healthcare delivery in Nigeria. As we are working on about 8 goals, the emphasis is on out of school children on goal 4, building more schools, preparing ground for the new intakes, and maintaining the existing structure. It's supposed to be the job of subnational government, but we can support in our little way, and that's what we are doing, building more schools, renovating the existing schools, and making it more conducive for learning. And on the health and well-being, which is very critical, especially at this time that we have COVID-19 pandemic that is taking the world by surprise, and it's also for us to be able to renew our healthcare infrastructure and make sure that it's well maintained. The 3 of SDGs, good health and well-being, is the mother of all goals. If you are not healthy or you are not alive, there's nothing you can achieve. So it's very critical to other goals. So if you are alive, you are well, then you can talk about poverty. You want to mitigate the effect of poverty, or you are hungry, or you want to send your children to school, but you are not. If you are not alive, all those things cannot be achieved. So it's very critical to all the other goals, and we are working very well with the subnational government to see that we are on the same page, and we are working in synergy to provide the best and give the best healthcare system or healthcare delivery. So for now, this is what we have on education and health. Other sectors will be dealt with as we move forward.
Nigeria will continue to support the United Nations in all its efforts, including the attainment of the 2030 Agenda for Sustainable Development. I thank you.
Agenda 2030, showing on this channel. Agenda 2030, leaving no one behind. Agenda 2030. As a successor framework for the Millennium Development Goals, the global community rolled out a bigger, deeper, and more encompassing framework called the Sustainable Development Goals, designed to transform our world, lift the poor out of poverty, as well as ensure inclusive and healthy society. On Agenda 2030, we take you on a media trip to the global destination of the future we want. With everyone on board, we focus on the people and their struggle, the civil society and their agitations, the government and her development effort, the Global Development Agenda, its 17 goals and 169 targets. We bring you all the deliberations, insightful conversations, and high-level partnerships on the road to global destination. Agenda 2030, showing on this channel. Agenda 2030, leaving no one behind.
My name is Professor Ben Ayade, Governor of Cross River State. I support Agenda 2030. I support SDG.
Agenda 2030, showing on this channel. Agenda 2030, leaving no one behind.
My name is Honorable Prince Rotimi Agunsoye, Chairman House Committee on SDGs, Sustainable Development Goals. Keep watching Agenda 2030.
Agenda 2030, showing on this channel. Agenda 2030, leaving no one behind.